The Immunization Act, that is now housed under the Public Health Amendment Act, criminalizes evasion of mandatory vaccination, with parents or guardians facing up to 6 months in jail or financial penalties for failing to immunize their children. However, the State Minister for Primary Health Care, Dr. Charles Ayume, says provisions in this act are not punitive enough given increasing zero immunization cases for traditional immunizable diseases, especially in urban areas.
We may have to evoke parts of the law. I mentioned that in our Public Health Act, there are clauses that hold citizens accountable if you don't take your children for immunization. Imprisonment and fines, that one is there. It is a must, it is not negotiable. Where we gave room for discretion of an adult, that is somebody above 18 years old, or a parent, that would be for the new vaccines. But for these vaccines that we have known for the last 30 years that work and that are guided by the advisory group on immunization, why would you as a parent refuse your children from going for a polio immunization? Those districts where parents are not taking their children, we will arrest them.
The numbers that are zero dose in absolute terms, and you can see where they are concentrated, mainly in the central region and slightly in the eastern region.
In Uganda, 14 vaccines are accessible, the latest being the malaria vaccine, which is administered in 4 phases. However, its uptake, like for many other vaccines, drastically drops in final uptake phases. Ayume has meanwhile cautioned against the uncoordinated manufacture of vaccines across Africa as investors seek to make profit.
The people who invest in these vaccine manufacturing plants are driven by profit. They're very expensive to set up. They're driven by profit. But to make profit, you need market. And our markets are small. Uganda is a small market of about 45 million people. So why I'm saying we need to move in a coordinated approach is that if Uganda says we are manufacturing polio vaccine and measles, Kenya should say we shall do BCG and maybe the Penta vaccine, and then Tanzania, so that we have an expanded market. But what I'm seeing right now, there is a very big uncoordinated approach on the African continent, whereby all these small geographical countries, if you look at West Africa, Benin, Togo, I think some of those countries are as small as West Nile. And everybody is going into vaccine manufacturing. We are going to go into supersaturation and we shall collapse.
Government is to soon establish Health Center 2 facilities in urban markets to make the service more accessible to vendors.
In some of these markets, can we put Health Center 2s there? So that mothers, because if you see a mother who is in a market like in Kisenyi, like Soroti Regional Market, Mbara Regional, City Market, they do not have time. Because for them, it is hand to mouth. What they sell is what they use for running their family for the next day.
Juliet Nalwoga, NTV.